After World War II, when the soldiers returned paralyzed from the battlefields and demanded to be treated, it was not possible. That was the beginning of the rehabilitation that has prevailed, to train the paralyzed bound to wheelchairs to be self-sufficient. Since then, 60 years have passed, and still, young men return paralyzed from battlefields and receive therapy that helps them to be self-sufficient in a wheelchair. That tells me that something in this field is wrong, that there has not been more progress.
Á sama tíma hef ég orðið vitni að geysilegum framförum á ýmsum öðrum sviðum læknavísindanna.
At the same time, I have seen great strides made in other areas of medicine, in the treatment of cancer, heart disease, and in ophthalmology. When I was a young nurse and began working in hospitals, chemotherapy for cancer was in its infancy. I remember that doctors debated whether treatment should be continued. And it was so trying and the results so meager. It was terrible to watch these patients suffering greatly in their beds, and in the end, they all died. But we didn't give up, and now, 40 or 50 years later, half of all cancers are cured.
50 árum seinna, eða 40-50 árum seinna, að þá helmingurinn öllu krabbameini.
The same thing needs to be done for spinal cord injuries. It must be decisive, it must be done with scientific accuracy, it has to be recognized by the medical community, and it must be done now.
Undir eftirliti, og það þarf að vera viðurkennt að það eigi innan vísindi samfélagsins að nú eigi að fara að snúa sér að þessu.
Seeing someone in a wheelchair does not give you a full understanding of the problems that that person has to deal with, apart from not being able to walk.
And then there are all those other things. Urinary infections, broken bones, not to be able to pee, or move your bowels, or not to be able to do this and that.
After Hrafnhilda's accident, her mother had been steadfast in her battle, and she has had results. Recently, Auður with the ISCI went on a public relations campaign on television in Scandinavian countries. The goal was to draw attention to the spinal cord injuries and exhort the Nordic countries to challenge WHO, the World Health Organization, to wield its influences and seek a cure for spinal cord injuries.
We live in a period of astonishing progress, not least in the field of medical science. Even so, we have not yet found a cure for spinal cord injuries, which affect the lives of millions of people worldwide. But we refuse to give up. With a new approach, dynamic thinking, and unity among all the nations of the world, we will eventually win. The spinal cord is a mystery, but together we can find the solution.
In March this year, I went to Copenhagen and delivered over 5,000 signatures to Mrs. Susanne Jacob, the regional director of the World Health Organization in Europe, and emphasized on that occasion that the World Health Organization should follow up on this.
And how did she respond?
I was well received in Copenhagen. They found the initiative interesting, and they are looking into it. Good afternoon.
Hello, can I help you?
Yes, I would like this whole wheat bread. Can you slice it for me?
Sure. Anything else?
And the Icelanders prize this woman. The president honored her with the Order of the Falcon. Auður has been voted the Woman of the Year, and Vigdís Finnbogadóttir, the former president of Iceland, has helped her with her work, as well as being the ambassador for the ISCI.